diabetes is one of the single most concerns as far as people in healthcare are concerned on our island. It affects many, many people, but the Guam Diabetes Association is an organization that seeks to provide education, awareness, help, and a sense of community for people as well as their caretakers, for people who have dealt with diabetes. We have several members of the organization right now. The president of the Guam Diabetes Association is a very good friend of ours, Mr. Scott Duenas. Half a day, Mr. Duenas.
Hi, good morning, and half a day to you.
All right, very nice to see you. Glynis Almonte also is here. She is the association's secretary, also wearing a very, very lovely green GDA shirt and rocking it proudly.
Good morning, Jason, and good morning, everyone.
It's been some time since you've been on our show, Glynis, so welcome back.
Thank you.
All right, and Agnes White is also here, the chairperson of the Guam Diabetes Control Coalition, another organization that provides wonderful resources for people and their families going through diabetes. So Agnes, welcome to you as well. It's good to see you. Oops, and just let me unmute you. Sorry about that. Half a day, Agnes.
Yeah, thank you.
Okay, and Winnie Butler is here too, and Winnie's got maybe the most gorgeous all-white piano that I think I've seen in a very, very long time. Winnie, can you hear us right now? I think Winnie was having some audio issues. Can you hear us, Winnie? Okay, we're gonna go. We'll get Winnie straightened out and everything. But I would like to start out with the fact that the Guam Diabetes Conference has been going on for a while. Always a very, very good event, and just because this medical condition is so prevalent in our island community, very, very necessary and very needed. So, Mr. President, if we can start with you and everything like that, maybe if we can give some context about what this year's conference will focus on, and now that hopefully the world's starting to get back to a little bit normal. How will the conference be as opposed to what we had to do last year?
Okay, good morning again, everyone. And Jason, thank you, and KUM for the opportunity for us to at least let the island aware that we're coming up with our annual conference. Okay, the theme for this conference is Pandemic Diabetes Care. And we have guest speakers from the Philippines and also locally. And as always, Guam Diabetes Association is concentrating a lot on educating our community on the issues that affects the diabetes. I guess we can call them client or that affects the individual. But anyway, our guest speakers, and forgive me for mispronouncing some names, but we got 3 guest speakers that are going to be presenting at this conference that's coming up. We got Michael L. Villa, that's MD, FPCP, FPSEDM. I cannot decipher those acronyms, but I'm pretty sure they're all medical terminology, and the qualification is there for them.
Well, the more letters you have after your name, probably it's a safe bet, Mr. Duenas, that you've got really, really good credentials, and you're a very very trustworthy resource.
Okay, yes, and he's coming from St. Luke Medical Center, Global City, the Philippines, and his topic is COVID-19 Insight, Diabetes, and COVID. The next speaker is Ma Teresa Chau Agakoli. That's a mispronunciation, but again, with the acronym following MD, FPCP, and FPSEDM. She's coming from the Medical City, Philippines, and her topic will be non-alcoholic fatty liver disease. It's a NAFLD and diabetes. Okay, the third speaker that is going to be there is Anna Joy P. Menendez, PhD, registered nurse, RN. And she's from the School of Nursing and Health Science, University of Guam. And her topic will be its impact on the mental health of the individual. And again, this conference, like in the past, normally is person to person or appearance live, but because of the COVID issue, the last year we went with the virtual, and then this year, of course, we are doing the same thing because of the restriction on group gathering of people. And our conference is scheduled for November 14, 2021. It's from 2 to 4 p.m. And we got numbers that you can call to register, and hopefully we see a lot of registration. And of course, remember to dial the first three digit 671, and the following phone numbers are 787-4148, 632-1971, 637-5103. And again, register, and there's a website to register. It's www.diabetesguam.com. So enter your email and look for the Zoom link for this conference.
Well, thank you very much, Mr. Duane. It's great oversight of what's expected to be a conference with a lot of very necessary topics. Agnes, I'd like to fold you in now because the Diabetes Control Coalition and everything like that. I know the message that you've always put forth to the community is diabetes can be controlled. And we had Dr. Keith Hornucci from the Wellness Center on last week, and he was explaining like some of the sensitivities and the particularities about diabetes and diabetes care during the pandemic. As someone who was caring for a diabetic parent, my father had renal disease, and then he was also on dialysis for a few years. One of the first thoughts that went through my mind when the pandemic started was, for diabetics, everybody said, our lives are going to change dramatically. But if you're diabetic, like you've got this whole routine and regimen that basically can't take a back seat. You still need to get your treatment. You still need to check your levels. You still need to know what's going on. The food you put into your body has to be on an, according to the safe schedule. And, in some very sensitive cases, you still need to get your dialysis treatment. So, Agnes, how will this kind of all fold into the discussions?
Well, Jason, those who are, we know that having underlying issues it puts you at a very high risk for contracting, puts you at a higher risk of being ill from COVID-19 if you get it, and of course, dying from it. But as far as contracting it, not as much as being very, very ill from it. So yes, it is very important to continue checking your blood sugars. You want to maintain your normal levels. You want your blood pressure to be normal. I think the emphasis should be more on control, on being healthy. I suppose, people have heard already for a year and a half so much, keep your distance, wear your mask, wash your hands. Now, can we have more positive messages like, let's get healthy, let's walk, let's exercise, let's eat healthy, let's control our weight, let's control our blood sugars, let's stop smoking. Some basic things that you can do. And those are hopeful messages because that's something you can control. And all of us can control that. It's not, lifestyle changes are challenging and they can be difficult. But let's start now. And it's important that we start now so that in the event that we do contract the COVID-19, we'll be able to fight it and not have to go into the hospital. That's the whole point. Even those who are immunized, have vaccinated, can get it and go into the hospital, but less of them go into the hospital, and they're able to, fight it. But if you can be healthy, give yourself a good fighting chance. Your chances are increased that you can lick it in the event that you get it. And let's face it, COVID's not going to be the first one to come. There's going to be something else also. So let's get healthy. That's what we should do. Be healthy. So you know what I tell people, Jason, how people say, be safe, stay safe. I say, be healthy. Get going, that's my message. When I say goodbye to people, it's just like, okay, be healthy. Instead of stay safe, I decided to reword my messages here.
Okay, so we're going to hold you to that. So every time we talk in this Zoom interview and everything, when your time to speak is up and everything like that, we're going to expect you to say be healthy. So go ahead.
Be healthy, Jason.
All right. Okay, one down. We'll keep
Okay.
that tradition going. Glennis, what are some of the maybe some of the misconceptions that people have, either as people that are treating diabetes right now, or even their caretakers and everything like that throughout the course of the pandemic, and how do we make sure that they know exactly what the parameters and what the environment really is?
Okay, during this pandemic, since last year, a lot of people lost their focus on their management. So they don't go see their doctor. Of course, they're scared that they might catch COVID. But we don't have to stop what we're doing prior to the pandemic. A lot of the clinics now, they do telehealth as well. So call or be on the telehealth and continue what they were doing prior to the pandemic. So with the Guam Diabetes Control Coalition, together with the Guam Nurses Association, we embarked on providing education to the healthcare providers, healthcare professionals, and non-healthcare since April. So we invited speakers from the different agencies to talk about diabetes medication, from pharmacists, food, nutrition from Payless, from Jose Calvo, physical activity, mental health, which is very important in managing the disease. And also the last one, we had it 2 days ago, talking about the at-risk diabetic foot and common foot problems from one of our podiatrists on the island, Dr. Melinda Sangana. So like what Aggie has been saying, so we need to educate, we need to tell people to take care of themselves. So continue taking your medications, of course, continue seeing your doctor and following what your doctor recommends. So it's not like you go to a doctor, your doctor suggests you have to do this. Then later on, people don't follow. So that's what happens. Then their blood sugars will be uncontrolled. Then they suffer a lot of these complications of diabetes, which, one of the most common complications that we see here are the foot amputations and, of course, the chronic kidney disease, people going into dialysis. So we don't want to see a lot of our people in Guam going through those conditions.
Absolutely not. All right. Well, thank you, Glennis. Okay. Winnie, are you able to hear me, Winnie?
I guess she needs to unmute her.
Okay. Yeah. Let me try. Okay, Winnie, can you hear me? Are you getting my audio all right, Winnie? It's good to see you on the show.
Yeah, okay.
Hi, Winnie. Can you see me, or can you hear me? I should say.
I think
Earlier.
Okay, it might be your speakers and everything, so we're gonna work on that. Okay. Well, we do want to wrap up. God, I would love to have Winnie's input. She's always such a strong voice on this topic and everything, and certainly her involvement in the conference is going to be much appreciated. But we do want to give people the opportunity to register. Once again, okay, Winnie's holding up a piece of paper that says "I cannot hear." So we'll certainly try and fold her into that at some point. We'll interview her separately. So again. Could we get the registration information one more time, Mr. Duenas?
again, I'd like to express my appreciation to the nurses, our volunteers that are always there for us to be able to continue our awareness education. And again, most of the people that are suffering from this disease need to be active. And in case they like to eat in moderation. Like you mentioned earlier, that it can be controlled. And I've seen it myself when I was diabetic earlier. All I had to do was cut down on the candies and the ice cream, and I went back to normal reading on my A1C. So it can be controlled, but again, sometimes it depends on your lifestyle.
All right.
Thank you, Jason.
So make sure to go to and register for the conference, everybody. Diabetesguam.com. Once again, Glynis, thank you very much. Agnes, we always appreciate your insight.
Thank you, Jason.
So Agnes, you promised us. You got to say it again.
So,
be healthy.
There you go.
And you can be safe too. If you're healthy, you'll be safer. Let's put it that way.
That's a great message. Okay, Glennis, yeah, final word, Glennis, please.
Yes, the conference we are providing 2 contact hours of continuing education provided by the Guam Nurses Association. And our provider is the California Board of Registered Nursing. So nurses and other allied health can get CEs when they register. And I'd like to thank our sponsors, Cosules, Mountain Pacific Quality Health, Guam
I can't get in.
Tokyo Marine, NANBO, Guam Diabetes Control Coalition, St. Luke's Medical Center, the Medical City, Department of Public Health, Social Services, Guam Lions Club. And we are also giving special thanks to Mr. Raj Sharma from Guam Webs for creating our Facebook page and our website. And proclamation signing November 4, Friday at 11:30. So please join us and check our Facebook page, the Guam Diabetes Association, and the diabetesguam.com where you can register.
All right, everybody, thank you so much. Yeah, and Winnie, we will reach out to you separately because we do want to give you your chance to speak. We're having some technical difficulties with Winnie right now, but thank you very much, everybody. All right, bye. Have a wonderful day. And please stay tuned, everyone out there, because the link will continue right after this.
100%. The Totomortna Tales.